So my name is Jens Pedersen. I work for Medicine Sans Frontières, Doctors Without Borders. It's a humanitarian advisor. I have a background as a nurse, which is how I came also to be involved in the current Ebola outbreak. We're still running behind. A lot more still needs to be done in terms of providing enough treatment beds in the three most affected countries, which remained Liberia, Guinea and Sierra Leone. We need more facilities, we need more people to assist the communities in identifying, locating Ebola patients, battling the stigma. We need to make sure that we have outreach teams of community health workers that can go find Ebola patients, take them to the facilities. A lot more needs to be done. We're still far away. The first feeling that struck me when I arrived at our treatment center in Monrovia was one of being overwhelmed. As a medical worker, not being able to have a cure and a drug to give your patients, it's incredibly frustrating. Of course, it's also very tough to see patients suffering from Ebola. There's absolutely no dignity in Ebola. The main thing you can do is to support patients psychosocially, give them supportive treatment. So that's what I felt I could do and what I could give to our patients. So inside the treatment center, of course, people are grateful. It's difficult for them to recognize me because I'm wearing the suit and I'm covered from top to toe. But we write our names on top of our white hood and then we are able to build some relationship with the patients. Of course, communities act different than the patients inside the facility because there's a lot of stigma, there's a lot of fear and concern. And I can understand people are concerned because Ebola is a horrible disease. So communities act with a little bit more suspicion sometimes. They are, of course, very worried when they do have an Ebola positive relative or member of their community. And sometimes, not on me or on MSF, but we have seen cases where this fear and concern from community have resulted in attacks and killing of healthcare workers. Well, it's important that we remain calm. It's important that we make sure that our students that have traveled or new students are arriving at the university feel welcomed. We need to, in an open way, discuss what is Ebola, what are the symptoms. It's unlikely, but of course it can happen. So as a university, we need to prepare as well. And we can easily do that, but the most important thing is that we do it in an open, transparent manner and that we make sure people are feeling comfortable. Both people that are not traveling, but also the ones that may come from affected countries. I mean, I can have had contact with Ebola. I can develop symptoms, and you may not be able to tell. So if you don't trust me that I come forward and tell you and the relevant health facility that I'm sick, I can very easily transmit Ebola onto you. So it's important that we are able to trust each other in making sure that if we do feel sick, if we have had a contact with Ebola, of course we need to first of all have had contact with an Ebola positive patient, then we need to trust each other to come forward. Well, hopefully there is an end in sight. We're not there yet. There's still a very long way to go. What I would like to see is that all the promises that have been made from international organizations and countries of providing treatment facilities, providing money, funds, healthcare workers, I think it's time now to implement and stop talking. And that's what I would like to see. Otherwise, we will not get anywhere.